Welcome back, my people. I still repeat my point. Let me hope one day you will never regret having no bundles in your phone. These diseases are very important in our today life, and they are very common in the community. So don't ignore. Let's continue keeping the support on. Let's continue subscribing, sharing, and commenting on our videos so that they might go viral. Let's get back to our topic, whereby we have been discussing about peuperal sepsis, and in this video we will be discussing about how is peuperal sepsis or postpartum infection diagnosed, or how can a doctor or a healthcare provider tell that this particular patient is having peuperal sepsis. So the doctor will diagnose primarily through a physical examination. That is the first step, and in all hospital setups, the first point of diagnosis in any disease is always a physical examination. The doctor will review your risk factors and check for fever, which is a major sign, fever, abdominal pain, bleeding, and foul-smelling vaginal discharges, which might be an indicator for an infection. The doctor might also check white blood cell count to see if your body is fighting back infection. Another question we can ask yourself: can peuperal sepsis cause complications? And which complication can come about as a result of a postpartum infection? These complications are very rare, but can develop if infection is not diagnosed and treated or managed in time and quickly, and include the following. So these are the few complications that can arise as a result of peuperal sepsis or postpartum hemorrhage not managed in time. Number one, we have what we call abscess or pockets of pus. Obvious, where there is an abscess or pus, it means there is decay or something is rotting. Number two, we have peritonitis or inflammation of the abdominal lining. Obviously, with an infection, the abdominal lining has to get inflamed. Number three, we have what we call pelvic thrombophlebitis. Pelvic thrombophlebitis. Here, blood clots in the pelvic veins. Here is whereby you find blood clots or thrombus in the pelvic veins. Number four, we have pulmonary embolism. Pulmonary embolism or blood clot. Blood clot that blocks artery in the lungs. Blood clot that blocks artery in the lungs. Number five, we have septic shock, which comes as a result of bacteria getting into the bloodstream and causing dangerously low blood pressure. Another question we have to ask ourselves: how is peuperal sepsis infection? How is peuperal sepsis or postpartum infection treated? How can it be managed? And how can it be treated? Definitely after diagnosing, after the doctor has followed all that criteria we have talked about, and he or she has diagnosed or proved that you are having peuperal sepsis, obviously the next step is always what we call treatment. So, here, peuperal sepsis or postpartum infections are primarily treated with antibiotics, which majorly are broad spectrum, given intravenously or through the vein, if the client is still in the hospital setup. A point to note: broad spectrum antibiotics cover variety. That's why they are called broad. Broad spectrum antibiotics cover variety of bacteria and are used when bacteria is unknown. They are used when the bacteria is unknown. So, what are the common oral antibiotics that can be used to treat peuperal sepsis? Number one, we have augmentin, which is a mixture of amoxicillin and clavulanate. So the mixture of the two makes it strong enough to fight peuperal sepsis. Number two, we have fibramycin, which is where there is doxycycline plus flagyl or metronidazole. Number three, we have levofloxacin plus metronidazole or flagyl. There are so many antibiotics that can be used, but that is just an example. I'm not saying they are the best, but that is just an example of common antibiotics used in a hospital setup. So, after treatment, what's next? Definitely we have to talk about prevention, or how you can prevent peuperal sepsis. So, prevention of peuperal sepsis includes precautions that or ways that may reduce or decrease the chances of contracting peuperal sepsis infection during cesarean section delivery. I hope you get that. And these steps or precautions which should be taken before cesarean section include: number one, removing of pubic hair with clippers rather than a razor blade, because a razor can be, by any chance, you can cut the pubic region and the opening will create way for bacteria to enter the body. Number two, taking a shower with chlorhexidine soap a night before surgery. Taking a shower with the chlorhexidine soap a night before surgery. Number three, keep normal blood sugar levels throughout pregnancy, as diabetes, as we have talked, can predispose one to peuperal sepsis. So make sure you keep the blood sugar levels level normal throughout pregnancy. So, prevention practices for the doctor. All the practices that the doctor can include to prevent this kind of an infection. Number one, prepare incision area with alcohol-based preparations. And these reduce the chances of bacteria survival in such an environment. Number two, administration of one-dose antibiotic before incision. This is what we call prophylaxis. You give a one-dose antibiotic before the incision to reduce the chances of bacteria. This comes 1 hour before the incision. Number 3, administration of entire course of antibiotics for GBS or bacterial vaginosis. This marks the end of our discussion today, or the second video today. Thank you for your time. Thank you for being with me. Thank you for the support. Continue keeping the support on. And please, guys, don't ignore this. These discussions we are having, all these conditions are very important. Don't you ever say you wish you knew. Have a good evening.